Welcome to the deep dive. Today we're tackling something that's, well, a real pain point for a lot of healthcare businesses, insurance benefits verification.
Oh, yeah. It's notoriously complex, causes delays, claim denials. It's frustrating for everyone involved, patients and providers alike.
Absolutely. But what if there was a way to sort of cut through all that? That's where generative AI is stepping in, specifically these new AI agents.
Exactly. We're talking about moving beyond just basic automation here. These AI agents, they're designed to actually understand and navigate the, let's be honest, often confusing world of insurance rules.
Making things smoother, improving reimbursements, which, let's face it, is always a major focus.
Always. So our mission today is to really unpack how these agents work, drawing on insights from folks who know this space well, like the teams at Aarogram.
Right. And maybe it helps to think about the evolution here. We started with, simple bots, very rule-based.
If this, then that. Pretty basic.
Then came AI assistants, kind of like co-pilots, helping humans out.
Still needing a lot of human direction.
But now we've got AI agents. These are different. They can act more independently, interact with data, actually achieve outcomes.
And benefit verification is just such a prime example of where this is needed, isn't it?
Totally. It's historically been so manual, so repetitive, frankly, tedious work.
And it pulls time away from what healthcare staff should really be doing, focusing on patient care.
Exactly. Think about the patient's journey before they even get to an appointment, especially outpatient. Getting benefits verified. That's step one.
It really is the critical first step.
And if you mess that up, it just snowballs.
Right.
Bad cost estimates, problems collecting payments up front.
Billing nightmares later on, and yeah, those surprise bills everyone hates.
So crucial. And we need to be clear, eligibility is not the same as benefit verification.
That's a really key distinction. Eligibility just checks, like, is the coverage active? What's the plan type? Maybe a general deductible.
Basic stuff.
Very basic. Benefit verification goes way deeper. It's about the specifics, the co-pay for this procedure, the co-insurance for that service, how the deductible applies to specific CPT codes.
CPT codes being the codes for specific medical services.
Right. You need that level of detail for accurate financial understanding, and eligibility checks usually just don't provide it.
Which brings us to the EHR systems. Many have eligibility checks and people kind of rely on them.
Yeah, there's an assumption that it's enough, but often it really isn't. It lacks that procedure level specificity.
So what happens? Staff end up spending hours on the phone with insurance companies.
Or they outsource it, which adds cost. And even navigating the insurance portals manually is inefficient and honestly prone to errors in interpretation.
It just seems like it should be easier. So why has it been so difficult to automate this effectively until now?
Well, there are a few big reasons. First off, the data you get from insurance companies. It's often inconsistent, incomplete, just not standardized.
All over the map.
Pretty much. Benefit info varies wildly between payers, even within the same payer across different plans. So old school rule-based automation just can't keep up.
Because the rules keep changing or there are too many exceptions.
Exactly. Payer-specific rules, plan-level quirks, service-level variations. You hit unexpected scenarios constantly. Random variations that trip up systems and even experienced staff. It's like trying to solve a puzzle where the pieces are always shifting.
Yeah, I could see how building one system to handle all that would be a nightmare.
It has been.
Uh-huh.
Then the second major challenge is provider-specific stuff. Benefits depend a lot on the provider's profile.
How so?
Like how they're categorized institutional, professional, facility. Their network status is huge. In-network, out-of-network, tiered networks.
And even figuring out network status isn't always straightforward, right?
Not at all. It can be surprisingly complex.
Yeah.
Then there's the place of service office, hospital, outpatient, etc. That can change verification and billing.
And I'm guessing standard practice management software doesn't easily handle customizing all those provider profile details.
Generally, no. Not out of the box. And imagine providers working across multiple states. They face layers of different payer rules. It gets complicated fast.
Like navigating a maze where the walls keep shifting, as you said.
It really is. And the third big piece is interpretation. Benefit information often isn't just simple data points.
It needs context.
Exactly. It's full of complex terms, conditions. You need subject matter expertise, familiarity with payer contracts, the specific context of the service and plan. Traditional tools just couldn't handle that kind of nuanced interpretation.
Okay, so inconsistent data, provider variations, complex interpretation needed. It paints a clear picture of why this has been such a persistent bottleneck.
Definitely.
So now let's shift to the solution. How are generative AI and these AI agents actually tackling these problems?
Right. This is where it gets exciting because generative AI, especially these large language models or LLMs, they've gotten incredibly good at understanding and interpreting complex, nuanced language.
Like human language,
Yeah.
basically.
Pretty much. Which opens the door to automating things like deciphering those tricky insurance benefit terms. And that's exactly what tools like Aerogram's Smart Verify AI agent are built for decoding that complexity to give accurate verifications.
Okay, so Smart Verify. How does it work? What's happening behind the scenes?
Well, first, it connects to a huge network of payers, over 1,500, all the big names you'd expect.
Hmm.
Aetna, Cigna, BCBS, United Healthcare, Medicare.
Okay, broad coverage.
Yeah. But it's not just grabbing raw data. The AI integrates the provider's profile, the patient's profile, maps the benefit info to specific CPT codes.
Ah, back to those crucial CPT codes.
Absolutely. And it applies those pair-specific rules we talked about. It's not just keyword searching, it understands the context.
So it's been trained on a lot of data.
A massive amount. De-identified data from thousands and thousands of patient interactions. This lets it interpret the benefit terms considering all the key factors.
Like what factors?
Things like the insurance plan type, subscriber relationship, patient state, the provider's network status and place of service, eligibility, coverage for specific services, and of course, those critical payer-specific rules and exceptions. It weighs all of that.
That sounds incredibly thorough. What about accuracy? Because that's the bottom line, isn't it?
It is, and through extensive testing and real-world use, Smart Verify is showing over 97% accuracy in benefit verification.
Wow, over 97%. That's impressive.
It really is, and that accuracy means providers can generate reliable CPT-level price estimates, offer patients instant price transparency.
Which patients increasingly expect.
They do. And it helps optimize the whole revenue cycle, minimizing that revenue leakage from errors or denials.
Okay, so walk me through the workflow. If a practice uses an AI agent like this, what does the process actually look like?
Sure. So it typically starts by securely pulling the patient's info from the practice's EHR system.
Okay, integration first.
Right. Then the AI agent connects to the right insurance payer, gets the raw benefit data. Then comes the intelligent part, figuring out network status for that patient plan, verifying coverage for the specific services.
Identifying the copays, deductibles.
All the benefit details, yeah.
Hmm.
Then it applies the correct fee schedules and boom, calculates the patient's estimated cost. It's pretty much end-to-end and fast.
You mentioned real time. How fast are we talking? Can you show that?
Yeah, there's actually a patient-facing demo interface that illustrates this really well. A patient can just select their insurer, maybe their plan, their state, put in basic details.
And this is just a demo, right?
Yeah.
IPA compliant.
Oh yeah, absolutely. It's a dummy system just for showcase, fully compliant. So they enter the info, and almost instantly it pulls back key stuff. Insurance active, in-network or out-of-network, plan type, and a list of covered services the provider offers.
The clarity right away.
Exactly. Then, say the patient clicks on a specific service they need.
Like an office visit or a specific test.
Right. It then shows the verified benefits for that specific procedure and the calculated estimate. It considers different fee schedules to payer rates, in-office versus online, in-network versus out-of-network.
Candace complexity there, too.
Definitely. It even factors in individual versus family benefits, primary and secondary insurance, and the whole thing, from entering info to getting that detailed breakdown, usually just seconds.
Seconds. That kind of speed and transparency, that could really change the patient experience, couldn't it?
Absolutely. Less waiting, fewer surprises.
And is it just a patient tool, or can staff use it too?
Oh, multiple options. There's a provider interface for staff and also an API. That means it can be integrated right into workflows.
So check costs on a website or verify benefits right inside the EHR.
Exactly. Maybe just a button click within the UHR chart. The AI works behind the scenes.
Speaking of EHRs, which systems does it work with? Is it compatible with the major ones?
Yep. Designed for smooth integration with the big players. Epic, Cerner, Athena Health, eClinicalWorks, even Salesforce if practices use that. The goal is easy option.
Okay, that makes sense. What about staff? Is there a big learning curve? Do they need a ton of training?
That's a great question and really important. The idea is no, not extensive retraining. Because the AI integrates into the tools they already use, the EHR, the website.
So it works alongside them.
Precisely. The AI learns and assists, providing accurate info right where they need it. It's more about giving them better data, not making them learn a whole new complex system.
That sounds much more manageable. From your perspective, what's usually the biggest blocker when practices consider adopting this kind of AI?
Interestingly, often it's about staff alignment, addressing concerns about jobs potentially changing or being displaced.
The AI is taking our jobs fear.
Kind of, yeah, it's a natural reaction. That's where leadership is so key. They need to communicate the benefits clearly.
That helps them.
Exactly. Show how automating benefit checks reduces the effort per patient, freeing staff up for higher value tasks. Things like proactive upfront collections, managing over-under payments better, appointment reminders, tackling prior authorizations.
Stuff that directly impacts revenue and patient flow.
Right. When staff see it's not about replacement, but about enabling them to be more effective, focus on things that really move the needle financially and for patient care. Adoption goes much smoother. We've seen practices reallocate staff to prior auth backlogs and see claim denials plummet.
That's a concrete win.
Yeah.
Do you have a specific example, like a customer story, that really shows this impact?
Yeah, absolutely. There was a practice about 5,000 patients. They had quite a few staff spending a lot of time just on benefit verification and creating estimates.
Manual grind.
Totally.
Yeah.
After implementing the AI agent, they saw an 80% reduction in the staff hours spent on just those tasks.
80%. That's huge.
It was massive, and it freed up those people to really tackle a backlog they had in prior authorizations.
Which are notoriously tricky.
Exactly. And the result? A significant drop in claim denials and a much better prior authorization approval rate. It just shows how fixing that one administrative step ripples positively through the whole revenue cycle.
That's a fantastic example. Really powerful. Okay, so as we wrap up this deep dive, what's the main takeaway for everyone listening?
I think the core message is that AI agents like Smart Verify are genuinely transforming healthcare admin. They're providing accurate, efficient benefit verification in a way that overcomes those long-standing hurdles of bad data and complex rules.
And for you, the listener, what's the value proposition here?
It means more efficiency in your practice, less administrative burden, potentially increased revenue from fewer denials and better collections, and honestly, a much better experience for your patients through that price transparency.
Fewer headaches all around, basically.
Very much.
All right, so here's a final thought to leave you with. If you could automate these traditionally really time-consuming tasks, like benefit verification, how could that free up your team? What could your healthcare professionals focus on instead? More direct patient care, innovation. Think about what new possibilities that could unlock for you and your organization. Thanks for joining us for this deep dive.